Hi everyone, my name is Alex Lunsmann and I'm a clinical director here at JAG Physical Therapy. Today, we're going to be discussing a few exercises on how to reduce and attack your chronic knee pain. So this first exercise is called the distal hamstring stretch. It's great for mobility within the knee. So what you can do is line up about here, lower your one leg down, keeping your toes flexed. Try and lift up. You're going to feel a nice stretch in through here, possibly in towards the calf as well. You want to hold for about 5 seconds, slowly let that back on down, and we'll do about 10 of those. So this next one is going to be a quad stretch. There's many different ways to do it. This is one of the ways that I feel is most comfortable. Your lower leg, you're going to keep straight. Your top leg, what you're going to try to do is keep your thighs in line here, bend your knee, try and hold, and just feel a nice stretch. For this one, you want to hold for about 10 to 15 seconds, and we're only going to do about 4 or 5 reps of these. You should feel a good stretch for the most part here down. If you want to work on stretching here and up, what you can do, instead of trying to bend your knee even more, bring your hip back like this. So this next exercise is going to be our Theraband terminal knee extension. We're going to be working on strengthening the quads. More importantly, we're going to be doing so into full extension, which is very important for our knee stability. Everyday activities. All right, so I got a nice band here. Let's just say if we're gonna focus on the right-hand side, all right, we're gonna bring it out just so that there's a decent resistance on it. All right, we're gonna get our feet together and we're gonna let the band bend our knee for us. While it's doing that, we're gonna keep our toes on the ground and let our heel lift up. So it's gonna look something like this. And then we're gonna stand up nice and tall, bring our heel back down and work on trying to straighten out our knee. Now, when we're doing that, you should feel tension right in through here, not so much back in through here. And this is something that I would do 2 sets of 10 to start with, and to really engage the quads, 3 to 5 seconds is perfect. So this next exercise is a bit more of a functional activity. All right, so we're getting the dual benefit of learning how to sit and stand correctly or by the book, while also helping to strengthen our knees and reduce some of our pain within the knees. Nice just dining room chair, anything like this, nothing too high, nothing too low. We're gonna stand in front of it, and we're gonna get our feet shoulder width apart, and we're just gonna work on shifting our weight back and down a bit, and then back up. If that feels too low, don't be afraid to grab a pillow, anything along those lines, put it here so it sits up a little higher. And one of the things to look for, if there's any discomfort while doing this activity, the first thing you should think of is trying to raise the height or one of 2 things. So the first one, oftentimes in the clinic, when I have patients with knee pain who struggle with this activity, or at least struggle doing it pain-free, they always come down and they sit more like this, more forward. So it puts a lot of tension on the knees there. So one of the ways to mitigate the stress on your knees is to, again, shift your weight back a little bit and feel like you're almost falling into the chair, rather than coming down here and trying to shift back. The other thing deals actually more with the feet and the alignment of our knees. So oftentimes, if you do this in front of a mirror, you might see your knees almost kind of cave in like this. If you notice that and you notice you have pain down in the knees more towards the inside, I want you to try something. Feet shoulder width apart, try to keep the pressure on your feet more towards the outside. It's gonna feel like you're moving from this position out, almost rolling the knees outward. That alone can provide a bit more support and stability by making sure our feet are in the proper position. That moves up the chain, that helps reduce a lot of the strain and stress on the knees. So those 3 things. If you have pain, raise the height of the seat. Make sure you're getting back far enough. In front of a mirror, have a family member with you. Look at how your knees are moving. Are they moving in or are they staying out like this the whole time? That's all I got for you guys today. I hope you enjoyed these exercises and they help assist you with limiting that chronic knee pain of yours. Make sure to visit jagpt.com to find your local clinic, and be sure to like, comment, and subscribe for more great content.